Hello everyone. Welcome to one more episode of DM Neurology Made Easy. Today I am making this quick video about the exam pattern of Nimhans Super Specialty DM Neurology exam. So I am Dr. Ahamed Subir. I am Assistant Professor in Neurology at MES Medical College. So let's jump into the video. So the DM Neurology exam pattern in Nimhans is actually containing of 100 questions, and the total marks out of which you will be rated would be 100, and each correct answer would be given a positive 1 mark. The total duration of exam is out of 90 minutes, so that means that you have less than 1 minute for answering one question. And about the negative marking, as in case of any MCQ exam, you have four options, and negative marking for this would be negative 0.25, that is 1/4 negative marking. So you should be careful while giving the answer. So some questions would be very difficult, and such questions you have to leave. And the marks will be available immediately after the exams, so that relieves you of many apprehensions of how many marks you would have scored during the exam. And the usual toughness of the exam varies actually. So last time the total mark for the Nimhans topper was 81, but that was quite different from that what was seen from the previous exam, Nimhans exams, about 5 to 6 Nimhans exams which was seen previously, because that time the topper mark was about 60 to 70 range. About it was 66 previously and 68 the time before. And the question weightage also differs time to time, that is yearly or with each exam. The weightage is roughly around 70 to 80 for neurology and 30 to 20 for medicine. And every year new pool of questions are comes for Nimhans exam, and it is put by the current Nimhans faculty during that time. And as you know, Nimhans has got lots of super specialty, that is subspecialties, especially in the field of movement disorder, epilepsy, muscle disorders, etc. So you can expect advanced questions or relevant questions or recent questions from this part. And what you have seen last time, a question from spinal muscular atrophy was asked, that is, what is the latest drug. That a question had come just 1 week before the Nimhans exam, and I had seen in the newspaper and had just put the question in my Nimhans mock exam, and the same question came in the Nimhans exam. So at this point of time I would expect the recent drug for Alzheimer's disease, which was released, FDA approved just 1 month back. So that is an expected question for next Nimhans. So you can expect that kind of questions in Nimhans, very recent and relevant question. And as opposed to what you may think, that Nimhans would people would be asking more of clinical scenarios, more are of one worders rather than clinical scenarios. And book suggested will always remain Harrison and Bradley, and you have to be thorough with Harrison. Don't think that it's institute exam, so you can skip the step of reading Harrison and go directly jump to Bradley. Definitely you have to read Harrison, get thorough with it, and then go and read Bradley. And Bradley tables you have to be thorough, because lots of questions are asked from Bradley. And a book written by Dr. Omkarnath was suggested by lots of people who had written Nimhans and cleared about 3 to 4 years prior. But how relevant that book is right now is actually a matter of doubt. And as you know, repeat questions are very few in case of Nimhans. Reading that book alone won't suffice. So you can follow the group which I am doing, and because as you know, last time about 40 to 40, nearly 40 to 50 questions which in the Nimhans had come from what I had discussed, and also from my mock exams. I had done 2 mock exams free of cost during that time. This time also I will be conducting, but and about as you see, this was our results. 4 out of 6 in the mid session, and about 5 out of 10 during the November session of the Nimhans were from the group. So it was pretty positive that actually you need to study by yourself and need to solve the MCQs and mock exams. That is more than enough for you to crack even the toughest exams. And as you know, this is the time of corona. You have many apprehensions, especially in Nimhans, because there is a single center usually in Bangalore to write this exam. But understand that when things get tough, you have to go to fight all this much more harder. And as the saying goes, when the going gets tough, only the tough can get going. So try to overcome is all these tough situations you are facing, and try to overcome this. So I wish you all the best for this Nimhans exam, and follow my channel FB page, and subscribe this YouTube channel for further updates regarding NEET as well as other super specialty DM neurology exams and other entrance exams. Thank you.